Hi, my name is Sue and I'm in one of the birth rooms on the Women's Health Unit. I'm going to take you through the stages of labour, what you can expect and some ideas that evidence and experience tells us can be useful for women in labour. There are 3 stages of labour. The first stage, where contractions cause the cervix to thin out and open as the baby moves deeper through your pelvis. The second stage, where the cervix is fully dilated and the purpose of the contractions change from dilating the cervix to pushing the baby down and out through your vagina. And the third stage of labour, where the placenta is expelled and the uterus contracts to close off the large vessels that used to supply blood to the placental bed. There are 3 main hormones that can have an important interplay during labour. The first and most important is oxytocin. This is also called the hormone of love, and this is the hormone that stimulates your uterus to contract, helps with the bonding process between mother and baby, and also is important in breastfeeding. Feeling safe and secure supports oxytocin to flow, and is often why animals will go into a safe, warm and dark place to give birth. Endorphins are feel-good hormones. They build during labour and reduce pain. They help women feel sleepy between contractions and are responsible for the post-birth high that many mothers experience. And then we have adrenaline. Adrenaline is a hormone that is not useful in labour. It's our survival hormone. It's the flight, fight, freeze reflex, and it happens when we experience fear, stress or danger. Adrenaline stops oxytocin working, so it's important that the women feel safe and secure during labour. The first stage of labour is usually the longest, lasting an average of 8 to 12 hours in a first-time mother and 6 to 10 in subsequent births. It may start with mild symptoms like backache, period-type cramping and loose bowel motions. Contractions may be mild and irregular and start and stop for up to 24 hours. We call this the latent phase of labour, and it's usually when your cervix thins out and dilates up to about 4 centimetres. This can be a very tiring time. Your body is doing a lot of preparatory work for the act of labour, so it's important to rest when you can, eat simple, easy to digest foods for energy, keep well hydrated with alternating sports drink and water, and use simple methods to ease the discomfort, such as warm bath or shower, massage or a heat pack. Your baby should be moving during this time. It is not normal for baby's movements to stop during labour. Let us know if your baby's movements have reduced. Most women will be more comfortable at home in their own environment, and being in your own home can help the important labour hormones continue to flow. You can call the midwife at the hospital for more advice and support at any time of the day or night. When your contractions become more regular and stronger, lasting around 40 to 50 seconds and coming every 3 to 5 minutes, you will most likely be in active labour, and you may want to think about getting ready to come to the hospital. If this is your first baby, you may still have some time to go, and if you are still comfortable at home, then it is okay to stay at home for a little while longer. If it's your second or subsequent baby, then you will know your body and when it's time for you to come to the hospital. Remember to call us so we can be ready to care for you. Occasionally, the contractions will slow down or even stop when you come to the hospital. This is often due to the hormone adrenaline, from the anticipation and excitement of going to the hospital. When you get here, we will watch and wait to see if your contractions increase in number and strength and monitor your baby to ensure he or she is well. If the contractions slow down and your baby's monitoring is normal, we may suggest to go back home so that your oxytocin can build again in the comfort of familiar surroundings. In order to feel safe and secure, it is important to provide a warm, dark space for the woman in which to labour. We will dim the lights and limit distractions as much as possible. You may also like to bring some items from home to help you feel comfortable as well. It's a good idea to stay upright and be as active as you can during labour. Try to adopt leaning forward positions to help your baby move through your pelvis easily. You can still use a bath or shower if you don't need continuous fetal monitoring, and you can also use visualisation, hypnobirthing, mindfulness and meditation. I would, however, suggest you research these more and practice them at home before you go into labour. Your partner can also offer invaluable support through massage, pressure on the sacrum and hips, words of encouragement, helping you slow your breath down, encouraging changes of position, offering sips of water, nourishing food, hot packs, massage tools, and cool face cloths. Your midwife will also be able to offer many suggestions so that the two of you can work together to build the oxytocin and decrease the adrenaline while she is in labour. You may choose to use deep water immersion during your labour, and you may even want to give birth in our bath. If you have had an uncomplicated pregnancy and you have gone into labour spontaneously, you will have the option to labour in the bath. If you would like to give birth in the bath, you will need to be cared for by a water birth accredited midwife. There are 3 main medications that can be used during labour as well. Nitrous oxide and oxygen is a gas that you breathe in, and it provides some relief from pain and helps you concentrate on your breathing. Then there is morphine. It's a powerful opiate that may make you sleepy and help with some of the pain. Morphine does cross over into the placenta and may sedate your baby at birth, meaning it may need some assistance to take its first breaths, or it may not respond to its first feeding instincts straight away. And then we have the epidural. This is a thin catheter introduced into a small space in your lower spine to deliver medication to provide numbness from the waist down. The obvious benefit of an epidural is that most women will no longer feel the pain from contractions, but it will mean that you require an IV drip and a catheter to drain your bladder. Sometimes your blood pressure may drop and cause temporary drops in your baby's heart rate pattern, and this may seem a little dramatic, but we can usually correct this with more IV fluid. Sometimes an epidural may slow down your contractions, and we will need to stimulate your contractions with an oxytocin drip to keep your labour progressing. Having no more sensation can make pushing a little difficult, and you're more likely to need assistance to give birth with a forceps or a vacuum. Towards the end of first stage of labour, and just before second stage begins, usually between 7 and 10 centimetres dilated, your contractions may become very intense and closer together, and you may need to vomit or you feel pressure in your bowel. This is a very overwhelming period. During this intense time, support from those around you is very important. And I would like to add as well that at this time it's important for the support person to take some slow, deep breaths to help ground that person and stay connected to the woman. When your cervix is 10 centimetres dilated, your baby will be close to being born. The contractions may become more spaced out, and the purpose changes from dilating your cervix to pushing your baby out. Some women feel the urge to push straight away, and for others it takes a little while, and this is a time where you can enjoy the break and prepare. Second stage of labour takes between 1 to 2 hours for a first-time mother, and around 30 minutes to an hour for subsequent babies. During this time, you'll feel intense pressure in your bowel, and pushing feels like you are passing a bowel movement. It's important to listen to your body and trust your instincts. An upright position will help the pushing process, so standing, kneeling, sitting on the toilet can all be useful to move the baby down. When your baby begins to emerge from your vagina, you will feel an intense stretching feeling. Your midwife may offer a warm compress for your perineum to ease this discomfort. And this technique is also shown to reduce the risk of severe perineal tearing. It is also important that you work with your midwife or doctor to gently birth your baby. We know that if the birth of your baby is slowed down, this also reduces the risk of severe perineal trauma. A lot of women worry about having an episiotomy or a cut to the perineum during the birth. We don't routinely advise an episiotomy, but there may be times that it is recommended, such as a concern that this will prevent a severe perineal tear, to hasten the birth of your baby if the heart rate is dropping, if the baby is in distress, or if a forceps or vacuum birth is required. The perineum doesn't always tear, but if it does, it heals very well, regardless of whether you've had a tear or an episiotomy. Our doctors or midwives will be able to repair it with dissolvable stitches, and it should heal completely within 3 or 4 weeks. Not all births go to plan. Sometimes babies are in a position that makes it difficult to travel easily through the pelvis, meaning that the cervix doesn't dilate properly, and sometimes mothers or babies are unwell and labour may be detrimental. In these instances, a caesarean section may be advised. We call an unplanned caesarean section an emergency caesarean section. These would usually be advised before we are really concerned for you or your baby. Some women will be advised to have an elective or planned caesarean section. Sometimes women will choose to have an elective caesarean section if they've given birth this way before, and some will choose to aim for a vaginal birth with their next pregnancy. Talk to your doctor about your options for birthing following a caesarean section. Some women may have complications in pregnancy that mean giving birth via a caesarean section is considered safer than a vaginal birth. Our doctors will help you make an informed decision regarding the best mode of birth for you and your baby. After your baby is born, and if he or she is well, we recommend you put your baby skin to skin on your chest. This special time facilitates mother and baby bonding and breastfeeding, and let's face it, you deserve it. We also recommend delaying cutting your baby's cord for around 1 to 3 minutes. This allows blood from the placenta to infuse into your baby and increase your baby's iron stores. The third stage of labour is the birth of your placenta. We recommend an injection of oxytocin soon after your baby is born to reduce your risk of excessive blood loss called a postpartum hemorrhage. The midwife or doctor will then gently assist you to birth the placenta with gentle traction on the cord. This is not usually painful at all. If you choose to birth your placenta naturally, we will not give you an injection or oxytocin or assist the placenta to be born. We would encourage you to keep your baby on your chest and commence breastfeeding to produce your own oxytocin. We will closely monitor your blood loss, and if we're worried, we will discuss options with you. Very occasionally, the placenta can get stuck inside the uterus, and your doctor will recommend that they remove the placenta in the operating theatre, where the anaesthetists can provide good pain relief. This is a resuscitaire. We have them in most of our birth rooms in case the baby needs some support when they are born. Most babies are born with no problems, but occasionally some babies may need some assistance to adjust to the life outside the uterus, and for the most part it's just some help with the first few breaths. Some babies may need to go to the special care nursery for extra care, but our paediatricians and nurses aim to have babies and mothers reunited as soon as possible. Our team is committed to supporting you to have a safe and positive birth experience. We look forward to working with you and being a privileged part of your parenting journey. I would like to wish you all the best of luck